My name is Philipp Grätzel. I'm editor of eHealth.com magazine, which you can take a look at right over there. You might have realized that in your program, Sönke Bartling was announced as a moderator for this session. He couldn't make it to Medica today, I'm afraid. He had nominated a colleague, Professor Katharina Adam, to do the moderation. She couldn't make it either, so I have taken over today. Welcome, everybody. Welcome to my 4 panelists instead of 5. I welcome Dr. Sebastian Krolop, whom you got to know already in the last session. Sebastian Krolop is leader Deloitte Life Sciences and Healthcare Germany. Welcome. I also welcome Professor Dr. Christian Dierks. He is partner at the Berlin-based law firm Dierks and Bohle. Welcome. I welcome Marco Liesenjohann. He is scientific advisor and head of blockchain at the IT Vendors Association Bitkom. And I welcome Dr. Eberhard Scheuer, who is CEO of eHealth Consulting based in Switzerland. Everybody is talking about blockchain, but what's the true potential? This is our leading question this afternoon. I would like to start with Marco Liesenjohann from Bitkom with a more propedeutic question. Everybody knows that blockchain is the technology behind Bitcoin, but most people don't know much more. What is blockchain? Why is it interesting for different sectors of industry, not yet specifically for healthcare?
To frame blockchain technology with regard to private and public blockchains, you could think of blockchain as a new tool to access data in databases. So there's one thing, this public blockchain ecosystem is developing very, very fast in the last years. And there's a lot of ingenuity to get new privacy-related methods. And so blockchain could be framed as an accelerator for privacy-supporting technology as a first thing. And the second thing is, I think we heading into the age of data economy. And there is a lot of open questions to what we think governance of data, how this could be structured. And blockchain technology is a new way of thinking about governance of data, so in general terms. And the third thing, I think, this is what you might have known when you read about Bitcoin or Ethereum in the newspapers. This is a point of blockchain technology as a decentralized ledger. And behind this, you can think of infrastructures which are more decentralized, and so they are less attackable or assailable by central point of failure questions. So this, I think, is a good overview about what blockchain technology as a whole or an umbrella of technologies could be framed.
Okay, thank you very much. One comment, we are having a discussion round without presentations. We are open to any questions from your end. Just try to give me a sign whenever you have a question and we'll include it in our discussion. I'd like to dive a little bit into other industries than healthcare. Another question to you, Mark, before we switch to the other contributions. What kind of industries are particularly interested in blockchain technology, and where do we find relevantly big implementations already?
Okay, blockchain technology is the first application, and the first term for the technology itself is combined in Bitcoin. Bitcoin is a technology and an application at the same time. And so the financial sector was the first sector to get to know this kind of new way of storage of data. But actually, get a lot of things with blockchain technology aren't really fitting to the regulatory standards in this sector. So there was a lot of work to get private blockchains into work, and this just means that you have some techniques from the public blockchains adopted and get some general access rules to blockchain technology. And we see some systems, for example, for the payment infrastructure, which are already using blockchain technology, and there are a lot of pilots in the pipeline. And other sectors which are interested in blockchain because of the traceability feature is, of course, the logistics sector, and as well we see a lot of potential in the area of AI, because you need reliable data and a high data consistency, and also blockchain is there a good solution to provide this.
Thank you very much. Eberhard Scheuer, you have recently published an article in our magazine on blockchain in the healthcare business. Could you expand a little on what Marco just said within the healthcare sector? Why is blockchain interesting in the healthcare sector? What kinds of applications come to your mind?
Well, you have to understand that recently meant April this year, and in blockchain 1 week counts as 1 year, so that has been ages ago already. So the landscape has already changed a little, but before we go into the blockchain technology and what the benefit of blockchain technology is, I would like to ask the audience, who of you owns cryptocurrency, i.e. Bitcoin or Ether? Okay. Who has ever used cryptocurrencies to buy anything or to what it's used for? Okay. So that's very often the case, that we talk about blockchain and especially the tokens or the cryptocurrencies associated to it. But most of us, or most of those who possess cryptocurrencies, do it for the fun or just the curiosity or the speculative nature of it. And if you bought Ether beginning of this year, you made a very good deal. So anyway, but coming back to what's so new about blockchain, it's all what you already mentioned, but certainly the most important part of blockchain is that nowadays you can implement so-called smart contracts. So they execute themselves on the blockchain once one of the condition A, for example, is there, and also condition B, then automatically condition C is executed. What does it mean? For example, in insurance, there's a company called EtherRisk. What they recently did, they made insurance, travel insurance. So whenever your flight is delayed for an X amount of minutes, like say 90 minutes, you automatically get your compensation. There's no insurance employee who has to look at it, so it's just executed automatically. You don't need anybody in the middle who's doing the transaction or overseeing the transaction. So that's why basically the industries are not interested in it. They are scared of it. When we talk about banks, they're scared that we don't need them anymore in the future.
Should healthcare be scared? And if so, who could be replaced in a potential scenario by blockchain technology?
I think we should not be scared. We should look into what new ways of, for example, data management we have, and also what kind of security we get with, and also process optimization. But I'm sure Deloitte can tell us much more about that.
Thanks for asking. My next question. Can we maybe collect some examples of blockchain in healthcare from your experience, just to get an idea in what different fields it might be used in the future? I think you're the ideal person to do that.
Hope so. Let's give it a try. So why blockchain in healthcare? What are we seeing so far when blockchain is used in healthcare? So if you're looking at the internet, and if you just had the discussion before, technology is helping to make healthcare better. Full stop, period. We know that. There's a problem with the internet. No one of us is going to send one mail from A to B just via the internet. We're not sending money, we're not sending messages, we are using intermediaries. We are using Google Mail, Microsoft Outlook, we're using our banking apps. We will never ever use the internet by its own because it's just not safe, right? That's why we're using intermediaries. We need someone who's using central, like my Outlook server, so I'm sending my emails via Outlook. Now the problem is, whenever I'm using one of these intermediaries, they're having my data on a central point, right? So if my health data would be there on a central point and someone is hacking into these central intermediaries, I have a problem. So I need to trust Google, Amazon, Facebook. Now with the blockchain, it's totally different. I don't need intermediaries. And that's the fun part. I don't need Facebook. I don't need Amazon. I don't need anything. I can send from me to him my personal data if I want to. And almost no one can hack into these systems, and it's not centralized. And now you understand the power of a decentralized system where you can exchange data, which are really, really serious in the way of I don't want anyone to look at it, as long as I'm not deciding that someone can look at it. And that's why we don't need these intermediaries. And that's why the banking, the finance system is the first one who was attacked by blockchain, because nobody needs banking. And the next question would be, do we need really pharmaceutical companies? Do we really need hospitals and so on and so on? Yes, of course, but not all of them. We don't need intermediaries which are not driving value.
Okay. We've talked a little about potential applications. We will do more of these applications in a minute. I wanted to bring Christian Dierks into the discussion. There's more to blockchain technology than technology. There's also legal aspects. You have been dealing with the topic for a while already. Are there any, or let me put it another way, do you already have customers in your daily routine in your law firm that deal with blockchain, and have you ever consulted a customer on blockchain-related topics?
We did not yet have a customer who came to us and said, I want to apply blockchain technology, but we had several customers who came to our law firm and said, we want to solve a certain problem, and I said, why not use the blockchain?
Yeah.
So 2 weeks ago, I reported about the blockchain seminar that we had in Tallinn at the eHealth conference to my fellow colleagues. It was a working group of pharmaceutical lawyers. We were having our seminar in Switzerland, 30 lawyers from the pharmaceutical industry. And I said to them, would you like a brief summary of the blockchain seminar in Tallinn? And then somebody said, what's a blockchain? And I said, now come on, who doesn't know what a blockchain is? And out of these 30 lawyers, there was none who knew what a blockchain is. So what does it tell us? It tells us that obviously the blockchain works without the lawyers. That's good news, right? And it tells us probably too that there are many lawyers that are not up to date, that forgot that one of our values should be never stop learning, and that we need to go on with the technology. Now, we have started to look into blockchains about 2 years ago, and I'm quite happy that we have a new topic on this podium here, because over the past 10 years that I had the pleasure to participate here, we were more or less focusing on the same issues all the time. So this is new, and that's exciting. Now, the novel thing is that we have about 7 technologies that go in parallel to make a blockchain possible. It works without an intermediary, and that makes it something very difficult to assess from a legal point of view. Because IT is usually associated with data protection. Now, does data protection apply to the blockchain? Let's look at the scope. The scope is on personalized data. Does the blockchain involve personalized data? It mainly works with keys. And it's in full transparency quite often. For example, look at Bitcoin. You can see which public key is used to buy which amount of Bitcoins. Every 0.2 seconds, I guess, you see a transaction in the ledger. And so it's anonymous because there's only a key. And then we say, well, in that case, data protection cannot apply because we know it doesn't apply to anonymous data. But it is possible to identify people behind the public key if they use the public key for something else. And there are publications in scientific journals that tell that there is indeed a potential to re-identify people that use a public key on several occasions and do not develop personalized keys for every transaction differently. So it may be that data protection law is applicable to that. Then the next question that the lawyers usually ask, who is the responsible entity that deals with the data? And now we're in trouble. We don't have a responsible identity because that's exactly the idea behind the ledger, to not have that. So we do not know which law has to be applied, European law, or it may be everywhere. So that is a difficulty in its own. Then we know data processing works on consent or legal empowerment for processing. And the consent needs to be informed. Do the people that participate in the blockchain have the proper knowledge to consent to their data being processed in that? And do they have a consent? And this is all very theoretical, but when it really gets down to the bones is when we say, what happens if I revoke my consent? I want the data to be corrected. I want it to be erased. I have a right to be forgotten, remember? How does it work with the blockchain? Well, it doesn't, because the ledger is permanent. So here we have an entirely new issue, and I have a lot of questions for you on that, but not really so many solutions at this time. But the lawyers are approaching this topic. A year ago, there was just one essay on legal impacts of blockchains. Meanwhile, it's a couple more, but it's a very, very timid approach towards that. I think I'll leave it for the moment.
Okay, but back to you again. You mentioned that you have actively asked customers why they don't use blockchains for certain problem solutions, tools they want to develop. What kind of tools are these to get a feeling?
Clinical studies, patient registries, clinical registries, distribution chain management in the pharmaceutical industry. It's actually being active right now. Merck has a process with a company in Germany. They work on that. Sometimes it's not really obvious because the blockchain can be used to distribute and deal with items that can be duplicated because they are digital. Like I could sell a digital photograph to you, and with the ledger, we can guarantee that I cannot sell it to anybody else. So for clinical data, it's not obvious to apply that. But it can be transparent and it can be secure. So these two functions will be very relevant for that. And I suggested this to a group of scientists that have different projects where they cooperate, and they have a very difficult setup to transfer all the data and to guarantee the values in that. And this is where it might be working. Besides, it's highly attractive to work in blockchains, and it might get you some funding.
Okay. You were nodding when he mentioned the pharmaceutical industry. It sounds as if you know a project in this field.
We have different use cases, so I wouldn't call it projects, because project normally would be big and broad and wide and international. But we have many, many use cases, and most of them are about supply chain management, right? How does ingredient A, B, and C, where does it come from, where does it go? And with a ledger, with a distributed ledger technology, you can really track down, and you have a real understanding of what's going on in your supply chain. And therefore, it's magic. And the other thing is financials. All the financial institutes are really concerned about being an intermediary, which nobody needs. And therefore, these are the major use cases we use.
Another use case that is often discussed in the medical field is the use case of electronic health records. We have one project in Estonia. They are trying to migrate their national electronic health record towards blockchain at the moment. I think Gartime is the company who is doing it. We have one company in the UK called Medical Chain or something like that is developing blockchain-based health record solutions for the NHS. Is that something that is evolving? Can that be taken seriously in the context of electronic health record projects worldwide, or is it too early to really say whether? No? Okay.
Yes and no. So yes, absolutely. If the technology really, in the end, is as good and as great as we believe here on stage, but again, we need to prove it, right? We need to prove it. How secure is it really? How does it really work in real time? And therefore, again, you don't want to screw up your personal data, not your health data, right? So it's not nice if you're losing some bitcoins, but it's different story if you're losing your health data, or if your health data get be open to people you don't want to have them read. So again, it's obviously, if this technology works, it's the sweet spot to work in life science and healthcare. That's the nature point. I mean, supply chain is great, but it's about really getting data from A to B, which should be really private, should be really secure. You want to be in control. That's blockchain.
Christian Dierks?
I was deeply impressed by the lecture that the Estonian president gave in Tallinn 4 or 5 weeks ago now. And it was about the fifth freedom, which incidentally was the password for the Wi-Fi on the conference too. The fifth freedom being the freedom to move data freely within the European Union. And she said that her plan, or it's their conviction, that the empowerment of patients, that they are in control of their data and they can determine the data flows and where to store. This is something that can be achieved with the blockchain technology that Gartime involves. It's quite easy to do this, of course, in a non-federal environment with 1.1 million people. So in Germany, we're caught in the federal situation. But I guess this is the development that is taking place in parallel. Our conviction that the patients become more and more not from a data subject to a data controller. And in order to do so, they do need empowerment, which is education, to learn how to work with the data, what do the data mean, and then of course the technical abilities to have a responsible way to deal with the data. And that can be achieved with these technologies. And if that goes hand in hand, I think we're on a very good way, because I couldn't think of anyone better to take care of the data than the patient himself, because it's in his very own interest that everything is done best at high quality and nothing gets lost.
Any comment on electronic health records? I know Eberhard Scheuer again has written about that, but...
And maybe a small remark. This empowerment of patient data in medical records is one point, but the general theme behind it is the blockchain technology using to get your own digital identity. And I think this is this larger topic, what is very important for the upcoming data economy, that we as a person get our digital identity to us and not controlled by any central unit. This is one topic, and there may be different solutions, but identity management on blockchain is another overall topic here.
Christian Dierks asked his clients, why don't you do it on blockchain? My first question would always be, why do you want to do it on blockchain? Because we see a lot of projects where the solution is not the technology you choose, and either you choose blockchain or something else. It's really what you want to achieve with your project. So in the medical record landscape, very often I see like old wine in new bottles. So like the medical chain project you mentioned, it's a classical medical record, And I don't really see why this should be done on blockchain unless you want to integrate data from very different sources, like which is actually the everyday experience of a doctor in the healthcare system, or if you are, for example, a refugee and if you have your data in very different places, meaning also different countries. And with blockchain, you can really match it or pull it, know where it is and what's going to happen with the data. So it's always a question of, is blockchain really the right solution for your problem? And I think technology is one point. The other one is, being a psychologist by training, I always look at the motivation of people, why they want to do something. And one thing I learned in like 15 years in digital health is that you cannot motivate the patient to collect data. And all the apps you see, they all suffer from the network problem, the bootstrapping problem, that in the beginning you have not enough users in the network. It's like Facebook. If you had 10 users, nobody would care about Facebook. But if all your friends are in there, you have to join Facebook. And so blockchain, something that we haven't mentioned yet, is offering an incentivation solution for such apps, that by creating a coin or a token, your own currency, you can use it in your ecosystem to motivate the participants in the ecosystem to earn tokens. This is like what you do with the miner. If in a public blockchain, the miners are motivated to run a blockchain node. Why? Because by mining, they earn the currency like Ether or Bitcoin. And so we have to not only talk about, is the technology right? Is the technology containing process optimizations also can be motivate the network participants? And I think blockchain is a unique opportunity to align the incentives, the interests of all the network participants in the healthcare system. So can be a real game changer when it comes to data and healthcare.
Okay. Sebastian Krolop, you wanted to say something?
I think there's one point you mentioned in the beginning, you didn't mention it right now, which is a smart contract. And let's assume blockchain is going to work in the healthcare environment, and you're chronicle in, and you have smart contracts. Let's say you have chronic heart disease, you wake up in the morning, you're standing on your weight and 1.5 kilo plus. You took all your medication, again, you weren't eating a lot. It's clear there's water in your body, right? Now, normally what you need to do is you have to go to your patient, to your doctor, and so on and so on. Now, with a smart contract environment, there could be an environment where we say, okay, we understand what's going on. He just needs to change his medication, let's say from 5 milligram to 10 milligram Lasix to get the water out. And we don't have to wait until the patient gets worse and until he can't breathe any longer because the water is in his lung, and until he falls down and dies, right? So I'm right with you. We need to find out, is blockchain really the right technology for healthcare? But if I'm dreaming, and if I assume it could be, combined with the decentralized data plus the smart contracts, it could be a hell of a solution for healthcare.
The reality at the moment is that all over Europe, healthcare systems, governments are creating IT infrastructures already. So the question for someone who has been in this digitization healthcare business for a couple of years now is that compatible, or are we talking about a revolution that will make, provided we discuss as if it will come, will make everything else super not necessary anymore? So can you link your blockchain project that you just mentioned to the Swiss electronic health record, for example?
In Switzerland, I live in Zurich. In Switzerland, we now have the national patient record, and we even have a law, and it's implemented, and hospitals have to follow it. But the law was designed, or the project, the National Health Record was designed 2007. That's the year when YouTube was founded. So now, 10 years later, we are implementing something that has been designed 10 years ago. And you know how politics are. Once they get going, you can't stop them. I'm sure if we had known about blockchain at that time, we would have designed it totally different. We are not only, well, the Swiss national record is decentralized. So we have the Stammgemeinschaften, which is you can have different centers, but blockchain really is distributed. It's not decentralized, it's distributed. It's very democratic. So everybody can run a blockchain and you have full control of your data and can decide whoever you want to share your data with.
But still, you haven't really answered my question. Could we sneak in blockchain into the existing infrastructures, or is that either or?
Well, it depends how deep you, how strict you decide on the technology. In Switzerland, they defined it at a very deep technical level, so you have no chance to implement blockchain into the system. I hope Germany has maybe has the opportunity to be smarter than Switzerland and. Okay, sorry.
No, we don't.
Sorry, guys. Maybe you from Bitkom can elaborate on that.
Yeah, I'm not familiar with the exact date, but I think for the gematik infrastructure, it will be enrolled completely, or should be enrolled completely in mid of 2018, possibly. Yeah, this is a good question, and I would say for me, a lot of private blockchain projects are leveraging on different tools from public blockchains. And I think maybe for some ideas that are also implemented, for example, in the gematik infrastructure with a public key, you have a certain key to access. Maybe there will be in the future some opportunity to enhance it by the structures which we use in blockchains. And actually the point of anonymously using public blockchains, there's a lot of development right now, blockchain 2.0, you can call it, where you have control to hide the recipient of a transaction or the sender of a transaction or both, the content of the transaction as well, and you can give a certain key for regulators, for example, to give them access to see certain data points. So this is, I think, a toolbox where you can use some of these features to enhance maybe a next version of a IT infrastructure. But you already said it, when politics is running, then it's running, and we could maybe see in the future some enhancement by blockchain technology.
You want to comment? Okay.
I mean, we talked about gematik. Now, gematik is a typical example how you don't want to do it, right? And it's like, if you want to be disruptive, you don't want to ask the guys you want to disrupt, right? So if Airbnb would come to Hilton or Marriott and would tell them, you know, we have a great idea, let's do it, there would be probably some pushback. Well, maybe let's try it, and yada, yada, yada. So therefore, we have the problem that if you ask a system, you want to create yourself new, it will never ever work. Now the stretch with blockchain in healthcare is we do need some kind of regulatory, that's what we believe on one hand side, but if you're looking at the blockchain, it's not fiat money, it's not regulated. And this doesn't feel comfortable right now for us, and that's why I think we need to learn more about this technology, but the sweet spot of using blockchain in healthcare is it's your system, the system run by patient, and they decide over the governance. It's not a payer or provider who's going to do this. And therefore, I guess, again, we need to learn more, but in the end, it would be probably very, very disruptive.
Your competitors from Frost & Sullivan recently suggested that we should have in healthcare some sort of blockchain consortia that find themselves together to get beyond this level of a single company blockchain project. Would that be a useful approach? And if so, who should be part of such a consortium? It was your competitor, so it's actually a question to you.
No, just kidding. No. I mean, look at the different currency. Step back. Look at the different currency. We don't know exactly if it's got Ethereum or Bitcoin or Ripple or whatever the names are. We don't know it yet, right? So yes, consortiums are always a good start, maybe. On the other hand, if you're really looking at disruptive models, it's one guy sitting in a garage, she or he have a great idea, and they push it, and then they're asking for money, and then they push it again. And so the question is going to be, is there going to be right now someone sitting in a garage thinking about healthcare, using a blockchain technology, and will they find a lot of money, and are they just going to push it out in the system? So if I would have to bet my money, I probably would go to, it's the garage guys, and they might one day get bought by Facebook or Google or Apple by the tech giants. I guess it's not going to be the AOK or TK or Deutsche Krankenhausgesellschaft. No.
If it was the AOK, Christian Dierks, and the AOK came to your office and asked you whether they could, whether it is justifiable from a legal point of view to extend their electronic patient record in North and Eastern Germany by blockchain technology, what would you tell them? Do we need some regulation before we can think about doing something like that, or should they try?
Come on, you know me. First, they should try. As a matter of fact, this is something that we do see right now, that some of the insurance funds have lost patients with Gematik, and I'm not holding Gematik responsible, but the systematical setup of the usual suspects to decide on something is not innovative in itself and cannot be disruptive. So if TK and AOK now enter into this world with their own digital instruments and devices, why not using a blockchain? I mean, this is, for me personally, I think new technologies are exciting, but they are not, just as Eberhard said, a purpose in themselves. We have to go for the goal, and is it applicable to achieve that goal with this technology? We're willing to experiment, we're willing to try it out, and I do see some legal gaps for the application of blockchain technologies, but I'm very confident that we can fix these. And the blockchain itself is neither good nor bad. It just can be employed on either side. And so if there's a good potential in it, we can use it and put it to a good use. That is definitely possible.
Okay. Before I let Eberhard comment, we are running out of time. If you want to ask questions, do it now. Make yourself known to us. You won't have many more chances. There's one question. Sorry, Eberhard. Give me. Okay. And please introduce yourself.
Hello, I'm just venture capitalist from Korea. And thanks for your lecture and discuss about blockchain. So you already said about public blockchain and private blockchain differences, and in the biofield, many people think or said it's a special area, so not public blockchain, but just private. Few specialists employed in private blockchain is the most suitable for regarding our bio area. But blockchain's positiveness is the our information's democratic part or regulation part. So which one is more suitable, public blockchain or private blockchain in biofield?
Okay. Public blockchain or private blockchain in the biomedical
answer
industry?
to that question?
You can.
Okay. Because I wanted to take that up already. So we talk about public and permission-based blockchain rather than private blockchain. If the guys, the existing stakeholders in healthcare do blockchain, they almost certainly do a permission-based blockchain because that's something they can control. Because they decide who is can participate in that permission-based blockchain. So that's what we see, that most of the projects, also medical chain you mentioned in Great Britain, they are building on Hyperledger, which is originally coming from IBM. Now it's run by the Linux Foundation. It's a permission-based blockchain. But for most blockchain geeks, it's not a real blockchain because they only say the only disruptive potential comes from public blockchain because nobody can control it. And we made the same experience. We just founded a foundation last week where we do, in the beginning, we trade health information. Or basically the patient can trade his health information. We do Airbnb for health information without Airbnb, basically. So that's what we're doing. And we started out with the idea of a permission-based blockchain, but then with all the regulatory stuff going on, is that legal and so on, we decided to switch to public blockchain because once it's running, nobody can shut it down. So that is really disruptive, and we didn't start in a garage, but sort of.
Okay. Any other questions from the audience? We're coming slowly towards the end. There's another session right afterwards. I have one more question in a somewhat different direction. We have the UN Climate Change Conference running next door here in Bonn, and I've recently read that the amount of energy that is required per day to deal with the Bitcoin network is more or less similar in size as of a middle-sized German town. If that is true, can there ever be a large-scale sustainable healthcare blockchain for sustainability reasons? Marco.
Yeah, one point, the actual estimates to get it on a year view are that the energy consumption of the mining of the Bitcoin network equals the energy consumption of Nigeria. Yeah, this 17th largest energy consumer of all countries in the world. But there's one point. This is clearly linked to the way of how this public blockchain, in this case Bitcoin, is finding consensus on data. And since the very beginning, 2011 and later on in 2014, are several other public blockchains running which are using other methods of consensus finding, so get the shared truth of one shared data consistency. And for example, if you use proof of stake, you can reach similar results with a public blockchain as in the Bitcoin system, but you don't need this huge amount of energy to get your mining hardware working. So there are already solutions, but market adoption, there are a lot of parameters which control this development.
Dierks?
I might add that I think it was in the year 1900 somebody calculated if the horse coaches in Chicago would grow by the number they did in 10 years, all the roads would be covered with 6 feet high of horse manure, and it came different. So these extrapolations have their own reliability.
Thank you very much. Oh, Sebastian Krolop. Okay.
Yeah, one thing. So mining, yes, is using blockchain technology, but it's not deep blockchain. We can use, so for mining, you need an immense power of computers to do these algorithm and to do this mathematical solutions. But that's different from just using blockchain for storage for your health data, just for an example.
We have to come to the end. Thank you very much for your interest in the discussion. Thank you very much to my experts here on the podium. I think we will have many chances to discuss blockchain again on similar media podiums in the next years.